Kia ora koutou coaches. I'm Yo-Yo. I'm a sports scientist of the New Zealand Silver Ferns netball team. Today, I'm going to talk about the implications and implementations based on female exercise physiology to optimize the female athletic performance of our netball team. Particularly, I'll briefly introduce the definition of netball in terms of exercise physiology. I'll talk about the menstrual cycle, its mechanism and individual variability, and give an example of a structured female health monitoring program to optimize the female netball performance. I also address the oral contraceptive pills about its influences and considerations. Overall, I hope today's talk will help you as coaches better understand the female exercise physiology and be able to better communicate and educate and communicate with the female athletes, individualize their training programs, and help them maintain healthy, train well, and perform better. First of all, a brief definition of netball in the exercise physiology context. It's a 7 versus 7 team sport, combine high-intensity short bursts of sprinting and jumping, and long-distance running for a 60-minute event duration. The Silver Ferns performance is considered elite level with season competition format. The sport itself, with its intermittent nature, involves both anaerobic and aerobic energy system with the combination of almost all the fitness components in sports and exercise. All these features suggest that to optimize their performance, we need advanced training methodologies and precise monitoring. And this requires our understanding of the significance of the menstrual cycle and its impact. A menstrual cycle is a recurring hormonal fluctuation in the female reproductive system that prepares the body for a potential pregnancy. A typical 28-day menstrual cycle can be divided into two phases in the simplest terms, the follicular phase and the luteal phase. The follicular phase, also referred to as the pre-ovulation phase, is a phase of the maturity of a follicle from day 1 of the menstrual bleeding to the release of its egg on the day 14 of ovulation. The luteal phase, or the post-ovulation phase, from day 15 to 28, is the process of the follicle transforming to the corpus luteum and preparing the uterine lining for pregnancy. If the pregnancy does not occur, the uterine lining will be shedded as menstrual blood and a new cycle begins. Understanding the vital hormonal fluctuation of the estrogen and progesterone is as important as understanding the effects of testosterone on the male physiology and performance. The estrogen is anti-catabolic and helps female feel strong and powerful, resist fatigue, and recover faster. It is relatively high in the follicular phase and peaks before ovulation as the follicle matures. The progesterone is catabolic and negatively influences muscle protein synthesis and increases fatigue, increases body temperature by about 0.5 Celsius degree, and causes food cravings and mood swings, etc. Its level is high in the luteal phase and peaks around day 20 with no pregnancy. The level drop leads to menstruation. If you look at the existing physiological studies, the menstrual cycle is highly variable. The average cycle is about 28 days, but the exact days vary substantially among healthy females, ranging from 21 to 34. The duration of bleeding varies from 3 to 7 days, and the individual responses are highly various too. Some females have neutral responses. Some are with severe premenstrual syndrome, the PMS, as you can see in this figure. Common symptoms include abdominal cramping, bloating, and fatigue, or the symptoms of menstrual phase, the MS, such as heavy bleeding and menstrual cramps. Heavy bleeding is worth noting because the excessive loss of blood, red blood cell, and hemoglobin decreases the body's capacity for oxygen supply, which limit the muscle contraction ability, increase fatigue, and decrease sport performance. Since there is a high variability in female menstrual cycle, we will need a systematic approach that targets female-specific needs in sports and exercise to prevent injury, improve health, and optimize performance. And this is referred to as the Female Athlete Health Monitoring Program. It requires effective communication and cooperation between coaches and athletes, with coaches educating the athletes tracking their menstrual cycle and optimizing the exercise prescription based on their feedbacks. The coaches need to help the athletes learn about their own physiology, be aware of how the hormonal fluctuation and imbalance interplay with the health risks, such as female athlete triad, which is associated with disordered eating, amenorrhea, and low bone mineral density, and a potential ligamentous injury, such as the ACL tear, which is 2 to 10 times more common in the female athletes than in the males. The coaches are responsible to address the ethical concerns related to athletes' privacy and data use, and taking away the stigma and shame about the menstrual cycle and create a safe and confident space for female athletes to share. The athletes should learn to track their own cycle with calendar and unitary ovulation kit, use body temperature measurement, and symptom observation such as the egg whites like vagina discharge and emotional changes. And also blood tests can be very accurate, but increases time and cost. And based on their tracking, they can provide feedbacks to facilitate the coach's monitoring and training prescription. Here's an example of a phase-specific 1-month mesocycle training prescription for our female athletes. These fitness components are associated with netball, and the periodization is differentiated by off-season and in-season. The key is to apply proper load, stress, and strain on our athletes by recognizing different menstrual phases to prevent overtraining and injury so they can safely grow stronger over time. For example, in the follicular phase, where females generally feel strong with high estrogen, the exercise intensity and training frequency can be increased to push strength gains and adaptation to the plyometrics. And as the sense of fatigue increases with the increasing progesterone in the luteal phase, it is necessary to gradually deload so that athletes can rest and recover, preserve energy, and prepare for a new mesocycle. But again, there is no perfect template for the periodization due to the individual variabilities, so we need to make adjustments and modifications based on our athletes' feedbacks. Finally, we shall talk about the oral contraceptive pills, or OCP, which are largely used among premenopausal female athletes. The common type of OCP is the pill, a combination of estrogen and progestin, and a mini pill with progesterone only. When taken regularly, the OCP suppresses the secreting signals of the endogenous sex hormones, thereby preventing ovulation and menstruation. The responses to OCP are highly various, so no specific recommendation can be made. What is known is that using OCP has no impact on the performance on a daily basis, but it negatively impacts the chronic training adaptation on the elite level, including decreasing such as peak power and slowing the anaerobic adaptation. And also it varies the hormonal profile in the fitness testing results. So for those who are planning to use OCP, the coaches need to inform them that it is not compulsory and they need to consider their purpose, length of use, and medical concerns. And for those who are already using, they need to know that it is not 100% effective and there are potential health risks. For example, the amenorrhea caused by low energy can be masked by the use of OCP. So tracking their own symptoms and responses are very important to address their individualities. To summarize, Optimizing the female netball performance on the elite level requires the understanding of the menstrual cycle, structuring an effective health monitoring program, and consider the OCPUs. It is overall very important to keep recognizing that female exercise physiology is different from males, and they need distinctive monitoring and training programs to become as fit as their male counterparts. And quality research studies in the future can greatly facilitate and sustain this process. Thank you.